as early as probably 5 or 6 years, if they're in cleats, or if they're, even basketball players on a hard surface.
Smart. Good evening, and welcome to this evening's Ask Portland Clinic chat on foot and ankle health. I'm Colby Reed, and I'm joined by Dr. Janson Holm, a foot and ankle specialist with the Portland Clinic. Dr. Holm, thank you so much for joining us this evening.
Glad to be here.
Now, Dr. Holm, as a foot and ankle specialist, what types of patients do you normally see at the clinic? How do people get referred to you?
We see kids from a fairly early age to as old as patients can make it in to see us. So pretty broad spectrum. Usually patients come to us on referral of their primary care physician. Sometimes they look us up. We're on the internet on ZocDoc, and so people a lot of times will find us on the internet and schedule appointments directly without talking to a primary care even. So we're very available, and we see people of all ages.
You mentioned that you see patients of all ages, but is there a particular age range or maybe a couple of different age ranges that you see that are more common for foot and ankle issues?
Yeah, we see a lot of times young athletes. We see, the active population for a lot of injury-related issues. We see aging population for unique issues to aged individuals. Arthritis is a common one for people older in age. So.
Okay. And what are some of the common services in the foot and ankle department that you provide?
We cover anything from the knee down, basically. Mm-hmm. So there's myself and one other foot and ankle specialist. We are surgeons trained as podiatrists to treat both non-surgical and surgical foot and ankle conditions.
Are there common foot and ankle issues that you see in the Portland area?
I don't know that anything we see is unique to Portland.
Turf toe is not a big problem in...
No, it's not necessarily region specific, but we see a lot of plantar fasciitis. That's a common issue anywhere you go. We see a lot of sprained ankles. In the more active population, that can happen in trail runners on uneven terrain. It can happen commonly in volleyball players and basketball players, and so there's probably unique things to each activity in each age group.
You mentioned, ankle sprains. Those are fairly common. People are pretty familiar with that term. Plantar fasciitis, I know that people probably heard that term but may not know what that is. Can you elaborate on what that exact issue is?
That's a very common foot problem. Just about everybody at some point in their life will have a touch of plantar fasciitis. And the plantar fascia, we'll use our foot model here. If my hand is kind of a ligament, it spans from the heel here to the toes out here. And when it's under tension, it stretches and tears and it gets inflamed to the point it creates pain. And so it's usually heel pain. People notice it mostly when they get out of bed first thing in the morning, usually. It can be mild and it can be severe. So there's a broad range of that.
Interesting. Now, we touched on this a little bit, but you mentioned that Portland has a lot of people that like to get out and get active and run around, and we're seeing this trend of barefoot running, minimalist running. I don't personally understand it in the rainy weather, but apparently it's popular. Is that something that can contribute to foot injuries?
Well, any activity can contribute to a foot injury if we're not careful about it. There's factors that come into play when we talk about whether or not somebody should participate in barefoot running or minimalist shoe running. People that are younger that have feet that can adapt can do very well with that as long as we give them appropriate guidelines for how fast to make a transition. People that are maybe a little stiffer, have a little more arthritis, or less flexible, less adaptable, are going to run into trouble with that. And sometimes we will see stress fractures in the foot as people try to make that transition too quickly, or in a foot that's really not set up to be able to handle it.
So if I were interested in trying barefoot running or minimalist running, I shouldn't just go take my shoes off and run down Nato Parkway. I should probably consult my medical professional for that, right?
Yeah, we're happy to give guidelines on that. A lot of the running stores, you'll run into people that have made that transition that can have some tips, but it is a process that takes time and that you don't just want to turn on all at once.
So one of the things that we like to stress on these Ask Portland Clinic chats is how to prevent injuries and how to prevent illness. In terms of ankle and foot injuries, what are some of the ways that we can prevent injury in that department? Are there specific stretches, things like that we can do?
Yeah. Again, a lot of this is kind of being sensible about starting new activities. It's being sensible about the shoes that you're going to wear for that. One of the most common issues that we find that contributes to injury is inflexibility. So an arthritic foot can have trouble. Tightness in the calf muscles. The calf muscle is a driver for a lot of abnormal foot mechanics. We can see stress fractures. We can see tendinitis if people aren't adequately stretched out. So it sounds very simple, but one of the best ways to avoid foot and ankle issues is to stretch your calves. And that's kind of your typical runner's stretch, that you're kind of bringing your foot up to feel a stretch in the back of your knee and in your calf.
And that's where you, for example, at the gym, you go up and you put your foot kind of at a 45-degree angle on the wall and just kind of lean into it.
Right, yeah, the kind of classic runner's stretch goes a long ways for foot and ankle health.
Okay. Now you talked about some of the different injuries that we can see in the foot and ankle department, and when we start to feel pain, there are people, myself included, who look, for any opportunity to skip the gym and say, "Oh, I've got a little pain in my ankle. I probably shouldn't push it today. I'll just sit and binge watch Netflix." How can you tell if the pain in an ankle or foot is something that's serious, or that needs to be rested, or you need to go to the doctor, or how can you tell if it's just something to suck it up and play through?
Well, everybody's a little different. Like you said, some people will look for an excuse. Other people are going to just try to really tough it out. In keeping it really simple, if you've had an injury and you can't walk, that's a bad sign. So if you can bear weight, it's usually not as severe of an injury. If you can't bear weight, then that's something that should get seen. You also think about time frames. So we would think most of the more minor kind of soft tissue injuries are going to resolve or start to improve significantly within a few weeks. So if it's something you can't walk on, or if it's prolonged and causing difficulty for a month or more, then those would be reasons to get in and have it evaluated.
And whenever I'm feeling pain in my legs or my feet or my ankles, I'm always reminded of a saying my grandfather taught me of, walk it off. If you've got some pain, walk it off. And I'm wondering if there's any truth to that, where if you've got an ache or a pain and you're not sure if walking for a few minutes, if you start to feel the pain go away, if that's a sign that it's something you should keep playing on, or if that's kind of a false test.
I think it's a good piece of advice. In a lot of ways, we'll have more minor injuries that are soft tissue. They're not fractures or anything creating instability in the foot. And walking it off, as long as you feel like it's improving with that, it probably doesn't need to have direct attention. So there's some truth to that.
Excellent, excellent. For those of you who are just joining us, this is today's Ask Portland Clinic chat. We're joined by Dr. Janson Holm, a foot and ankle specialist with the Portland Clinic. And if you have a question, please feel free to share with us on our Facebook page or on Twitter at #AskPortlandClinic. Now, Dr. Holm, if you were to sprain an ankle versus a major injury, so broken leg or something, or broken ankle, something like that, how long should you experience having pain or trouble walking? What's the recovery time like that?
Well, most ankle sprains you're going to be able to walk on afterwards. It'll be pretty painful, but you'll be able to walk on it. So right away you kind of get that feedback and know, if it's a fracture, you're not going to be able to do that. You talked about walking it off. If you can walk it off and you're feeling like you're feeling better, then that's a good sign. So anyone that can't bear weight, anyone that's having trouble walking, we're going to do an x-ray. We're going to make sure there's no sort of fracture or dislocation that needs attention. You can try to walk it off, and if it's not working, then make the call.
Yeah. And if it is potentially sprained, you can put weight on it, but it hurts. Is it typically, because obviously every injury is different, is it typically better to just go about your daily routine, or is it best to rest it as much as possible?
There's a little debate on that. Ankle sprains actually tend to scar a lot, and so if you baby it too much, it can actually create issues of scarring and stiffness. So there's kind of a fine line of using the ankle but not using it too much. So we tend to encourage motion after an ankle sprain. Even though it's somewhat painful, it can be a good thing.
Now, I want to get into some of the more serious foot and ankle injuries that we can be dealing with. If for example, someone breaks a bone or tears a ligament or something like that, what are the different types of foot and ankle surgeries that you conduct on patients?
Yeah. Well, in general, there's maybe a few categories. So, traumatic injury, so your fractures and dislocations, tendon tears. Those are things a lot of times that we would say this needs to have surgery to minimize issues in the future. So that's one category is traumatic injuries, and that's ankle fractures, Achilles tendon ruptures, dislocations, and smaller fractures in the foot. Another category would be elective things, and that's usually a foot that has some degree of deformity. Minor deformity would be a thing like a bunion or a hammer toe. More of a major deformity could be a severe flat foot or a severely high arched foot. So those are kind of deformity correction to minimize issues. And then you have elective surgeries related to arthritis. So the foot is prone to arthritis, and there's some joints in the foot that will develop it on their own. There's some that will develop it after injury. So we do a number of different surgeries for arthritis. There's a pretty broad spectrum of different things, but in general, it's kind of elective surgery that we pick the time, or surgery that's not necessarily considered elective that needs to happen because of an injury.
Now, when we talk about surgery for arthritis, is that something that can be purely preventative? For example, I fall while playing soccer and break my ankle, so now I know I'm prone to arthritis, so this procedure is going to help? Or is it something where you have to wait until you start to get symptoms and then you do this to alleviate the symptoms?
There are some preventive surgeries for ankle arthritis. Bad ankle sprains can cause damage to the joint surface, and if there's a small defect in the joint surface, treating that sooner with surgery than later is generally going to help us avoid issues of arthritis later on in life. The unstable ankle, we talk about ankle sprains that happen multiple times, frequent ankle sprains. That instability creates mechanical stress on the joint surface, and addressing the instability surgically, so tightening up those ligaments that are injured surgically can prevent arthritis, and there's research that backs that up. It's that particular surgery has been done since the 60s and has a lot of research that supports doing that early to prevent arthritis in the ankle.
So did I hear correctly there that if I've had 2 or 3 really bad ankle sprains, I could be more at risk for arthritis, and this is a surgery I might want to consider?
Yeah, bad ankle sprain, usually it starts with one really bad sprain, and then you tend to roll your ankle without any really big event. You step on a crack on the sidewalk and you roll it over, and if that becomes a more frequent issue, then you are at risk for arthritis in the future.
You talked about some of the other surgeries that you do on a regular basis, and those are dealing with deformities, things like a hammer toe and things like that. How common are those? Are there specific injuries like hammer toe, bunion, flat feet that are more common than others?
We do a lot of surgery for painful hammer toes and painful bunions. There's a lot of, people come in and say, when is it time to have surgery on this bunion? We see bunions of differing degrees and differing ages and spectrums, and usually the rule is that if it hurts, if it's keeping you from being active and exercising, that's not just a painful foot, but it's going to have some effect on your overall well-being, your overall health, and your mental state and whatnot. So people that are in pain for even those more minor deformities will have surgery, and that's a very common thing. Things like a flat foot, it follows kind of the same rules. If it's creating difficulty with exercise or making life hard, then we talk about surgical reconstruction of a flat foot. And those are all fairly common things that we do on a regular basis.
Interesting. Now, one of the things that we talk about on a regular basis on these chats is overall fitness and wellness. And one of the areas that we deal with is exercise and athletics. We have a lot of people in the Portland area that like to run, that like to play soccer, particularly kids love to play sports. Are there specific types of footwear or equipment that you recommend to best support the foot and the ankle for adults, for kids? Is it the same? Is it different?
A lot of it is dependent on the patient, dependent on their foot type. For adults, we would really kind of try to decide appropriate shoes for the activity based off of their foot type. For kids, we see a common issue. Again, we'll use our foot model here. There's a growth plate right at the base of the heel that can get really inflamed in a kid that is using a really stiff cleat and playing on a stiff, hard surface, or a basketball player playing on a court, tennis player. So for kids, we try to make sure that their shoes are appropriately fitted, and if they're in a cleat that is pretty stiff, a lot of times using a heel pad like this would kind of go in the shoe and support the heel, cushion the heel. That will help alleviate some of the pains that you'll get. So it's common to hear kids complain about heel pain when they're in their cleats or when they're on the basketball court. And that's one that we would see, and we'd have some definite recommendations for shoes and maybe an insert in the shoes.
You mentioned the heel cup. Is that something that you only use if there's pain, or is that something that parents should have their kids use potentially as a preventative measure?
Usually I wouldn't encourage them to use it as a preventive measure, but if they are having even the slightest hint of heel pain, then it's wise to treat it sooner than later. So my own kids, I wouldn't tell them they had to wear them for every game, but if they had any complaint of heel pain, then we would encourage them to. Yeah.
And is that something that you can just pick up with shin guards at the sporting goods store, or is that something you need to see the doctor for?
It's maybe a little difficult to find. I know you can find them online or in some of the more specialized athletic stores, but we stock that kind of stuff and help people out with it all the time. So.
And then going back to adults, you mentioned making sure you've got the right shoe fit for the foot. Is that something where if I'm running and I'm noticing that my foot or my ankle is giving me a little bit of pain, I should come in and almost do like a fitting in the doctor's office? Is that something you can check and help out with, or how does that work?
For good fitting, there's a lot of Portland's great, has a lot of resources for shoe stores with very skilled salespeople and fit technicians. We usually would recommend that you see one of those type of places. But people come in all the time with a bag of shoes and have questions about the shoes and should I wear this one or that one, and we certainly entertain those questions. I'm happy to provide that sort of advice.
Yeah. Okay. Tying it back to the idea of overall fitness and wellness, how important really are our feet and our ankles to the overall health and well-being of Portlanders?
Yeah, this is really goes back to what we were mentioning earlier, that the foot and ankle is kind of the foundation for activity. And for a foot and ankle that hurts, that's not normal, and it should be evaluated if it's starting to limit your activity. So the foot and ankle are the foundation for activity, and that translates into the ability to exercise, the ability to have a healthy and fit body. We're generally happier when our bodies are healthy and fit. And we're unhappy when they're not. And if we get to a point where exercise is difficult, that has all kinds of implications. So we look at the foot and ankle as the foundation to the ability to be active and maintain that overall wellness in terms of general health as well as mental health. It comes into play.
Thank you very much, Dr. Holm. Now, there's a lot of great information that we covered in today's chat, and I can guess that we have a lot of parents out there that are watching and maybe have questions about their kids' feet or their ankles, or they're making sure their shoes are ready for soccer this fall. And also, I'm sure we've got a lot of adults out there that are thinking about their own foot and ankle health. If somebody wanted to make an appointment with you or wanted to make an appointment with one of the other doctors at the Portland Clinic, what's the best way to go about doing that?
Well, you can call the main line for the Portland Clinic, and they'll connect you to the foot and ankle department. You can get online and look up the ZocDoc website, and many of our doctors are available for scheduling directly right there without even making a phone call. So you can get online and schedule appointments directly, or you can give us a call.
Excellent. All right. Well, thank you all very much for tuning in to today's live Facebook chat for Ask Portland Clinic on foot and ankle health. And a big thank you to our special guest, Dr. Janson Holm, a foot and ankle specialist with the Portland Clinic. I'm Colby Reed, and if you have any questions about foot and ankle health, or if you'd like to make an appointment with a doctor at the Portland Clinic, the best way to do that is theportlandclinic.com. Thanks so much.